Good evening and welcome everyone. We're just waiting for everyone to join the call. That will take a few moments and then we'll begin. Thank you. For those of you just joining, we'll just be a few moments while Zoom uploads everyone to the webinar and then we'll begin. We'll just give it a few more moments for everyone to connect with the webinar and then we'll start. Good evening and welcome to this evening's short webinar, Medic in a Minefield. I'm Andrew Moore, HALO's Director of Private Fundraising and Communications. Just got a few brief housekeeping points before we start. The webinar's been recorded and it will be available on our website next week. So if you enjoy it, please do share it with friends and anyone you think might be interested. Please do ask questions using the Q&A section at the bottom of the screen. You can choose to ask questions anonymously if you wish to. We'll endeavour to answer as many questions as possible, but if we run out of time, we'll follow up with you over the next week or so by email. Please note though that we're unable to do this with questions that are asked anonymously. And now I'd like to introduce our two participants this evening. We have Dr. Gail Ng and Dr. Jonathan Williams. Gail is from Singapore, but she's now an emergency medicine consultant in Salisbury in southwest England and has been a member of HALO's volunteer medical board since 2006. Jonathan is a general practitioner in Banbury in Oxfordshire and has been on the medical board since 2002. Sadly, we were due to be joined this evening as well by Gordon Chafacharowa, one of our head medics in Zimbabwe. But unfortunately, due to an increase in coronavirus infection rates, a curfew has been imposed in Harare, and Gordon hasn't got internet at home. He's currently on leave, but he kindly came into the Harare office this morning and recorded some of the points he would have covered if he was with us. So we're just going to play a short video now.
Okay. Hello. Thank you for having me. My name is Gordon Chafa. I've been with the HALO Trust since 2016, and my main role in the organization, one of the head medics. We working on the front line with the miners and all the teams. And when it comes to the roles that we do is that we are the first respondents in an event of an accident, be it motor vehicle or mine accident. Personally, I am one of the persons who is a victim of a mine. I lost my leg while I was serving in the army, and I got a lot of support from the army, and I did not stop to work. And when I resigned or retired from the army, I felt it was good to also help people who are in mine risk areas. And that's the most motivating factor, that I always want to help someone or prevent other people from becoming a victim like myself.
So you lost your leg standing on a landmine when you were in the army. People are still losing their limbs 40 years on. Can you tell us a bit about the impact it has on their lives?
That's one of the sad situations that we meet in mine risk or mine infected areas, that excuse me, the mines do not actually destroy themselves, but they wait for someone to disturb it, and when he is injured, it's a lot of impact on the person himself and the family. And apart from one individual being hurt, there is also a negative impact in terms of development within that area. Some other lands or areas that are mined, there are fertile lands that could be used for development or for agricultural purposes. Some of them are grazing areas, and people lose their livestock. People are afraid to go into those areas, and that's the biggest impact, especially on the rural and the development of that area.
Can you tell us a little about the people you trained to be paramedics for HALO?
Yes, those are one of the important group of people in HALO, because they only do not serve as deminers, but they are also a first respondent, and through them being trained, it makes the work very easy for someone who would have been injured during work or otherwise, and at the same time it also raises the morale of other persons who are in the demining fraternity, that he knows that if I accidentally get hurt or if anything happens to me, he will get help within a very short space of time, and he will be treated by some people that he or she is working with. So on that part, it's a very good moral raiser, and we want to try and keep up and lift our standards of first aid.
Great. After you have finished your work in the minefields, you and the other head medics treat people from the villages next to the minefields. Last year, that involved treating over 2,000 people. Can you please tell us about the difference this makes to the people you treat, perhaps with an example of the case?
I would want to thank the organization for giving us that support, and so that we can help the locals, because with the locals there are the persons or the group of people that we work with, and there are also the people who live far away from hospitals or clinics. So with the help that HALO Trust gives to the locals who are within our immediate environment, it's a very good help, and we wish to keep on helping them. And we always get a feedback that sometimes most of the people that we help, because of the shortages of drugs in the country and the situation like distances, they appreciate that that help should.
We're grateful to Gordon for sending us
extended, and they are very happy about it.
We're grateful to Gordon for sending us that message this morning. Gail, when you've visited HALO countries on your annual visits, you get to see for yourself the difference that stepping on a landmine makes to people's lives. Could you perhaps talk a little bit about what you've seen, please?
Yes, in 2010 I went to Mozambique, and I met a little boy. He was probably about 9 or 10 years old at the time. He lived just up the hill, and he has to walk through the village, walk through a minefield to go to the village. And about a year before that, he went through this normal path through this minefield, but then stepped on a mine, and unfortunately he lost his leg. You can see the picture of the boy. I mean, it's got a great impact basically on his life. He's when I saw him, he was hopping around very quickly on that one leg, and also used his crutches very easily. But the main issue one of the issues of children being injured in minefields is that the country often struggles to get prosthetic legs for children because they outgrow it so quickly. And HALO managed to source a prosthetic leg for the boy, and managed to get a leg for him from Zimbabwe, which was amazing.
Thank you. Thank you, Gail. Jonathan, Gordon touched a little bit about on the impact that our paramedics have on their colleagues as well, and giving them the confidence to know that they will be well treated in the event of in the unlikely event of an accident. Could you tell us a little bit about the people who become HALO paramedics?
Yeah, sure. The paramedics are all recruited from the demining workforce. So they all started off as deminers, and they're normally recruited, well, they're often recruited from areas which are heavily mined, and their villages may be being cleared when they're recruited by HALO. Many are farmers, and indeed many are women. There are now entire teams of women in some programs. The paramedics, when they start their training, they're not required to have any nursing or medical training prior to becoming paramedics. Indeed, I've met some who've had little formal schooling, and this becoming a paramedic is seen as being a promotion. But as Gordon said in his piece, they're still working as deminers, and this has the significant advantage they're very close by in the unlikely event of a minefield accident, and they are extraordinary people. Great to see them training. And here we are. This is a picture of a Casevac exercise. I think this is in Laos. You can see they're relatively young, some of them. The senior medic is in the background with a clipboard supervising the Casevac, and they've undertaken this exercise to perform first aid on a person with multiple injuries. And they are, as I say, they are extraordinary people.
And often this work takes place in really challenging environments, with access to the minefields being extremely difficult, and obviously subsequent access to hospitals. Gail, you've seen some of these extreme environments. Could you talk a little bit about them, please, and how they relate to the plans to evacuate casualties and the training that HALO provides?
I've done medical visits to 9 countries with the HALO Trust, and every country is different. So you could have a country like Angola where perhaps an evacuation can take about 8 to 9 hours on uneven roads. In Laos, as well as in Mozambique, you can have a Casevac, which can be by boat, just because there is no access, there's no road access to the minefields, or because there's mountainous regions or dense vegetation, which makes it particularly hard to get casualties out. So, you know, we have to make a plan basically in terms of how we evacuate our casualties. Some in places like Colombia, it could be an hour-and-a-half walk through very steep hills. So this picture here, basically, sorry, that was the boat Casevac, and this is the one in Colombia where it's very, very steep hills, dense vegetation, and it's wet, wet, wet. So it's really hard to get your casualty out, which then leads on to how we get the casualty. Do we go by land, where it could be an hour-and-a-half walk, followed by perhaps across a river, and then an hour-and-a-half drive in a car to a level 1 medical center, which then might require another 2.5-hour drive to a level 3 or 4 medical center? Or do we do a helicopter Casevac, for which you need to think about where you're going to land the helicopter, and if the conditions are not right, you can't land a helicopter as well. So then comes to the training as well, at what we provide. We need to think about not only just the medical training for the casualty, but also how we get them out. So do we use a stretcher perhaps, which might not be feasible in places like Colombia, or perhaps just a big long stick with a huge bag where you put a casualty in it, and you still have to monitor the patient through that long transfer. So it's very, very challenging, not only just the medical treatment, but just also the thought about how we get the casualties out.
I'm sure some of those challenges are part of what appeals to you as doctors in your involvement in HALO. But Jonathan, you've now been working with us for 18 years. And I wonder if you could just tell us a little bit about what drew you to working with HALO, what's kept you so long, and then perhaps what you get back from it, for what you bring back here to the UK from your time spent with us.
I was, it does seem a long time ago. I was I was one of 3 GPs from a practice in Banbury, and we felt that we wanted to do something different and useful and perhaps overseas. And we discovered we were able to undertake visits for HALO, and it was only 2 weeks, and we could do that alongside a full-time NHS job. And I think, well, my motivation is nothing. Having listened to Gordon in his piece, my motivation is but nothing compared to his. The 3 of us went along to the first medical board meeting, which is an annual event, and we just found ourselves amongst like-minded people. And after my first visit, I was completely hooked. I met some really, truly extraordinary people. I went to an extraordinary place. My first visit was to Nagorno-Karabakh, which I probably couldn't spell when I went there, and I certainly couldn't have pointed to it on a map. And I just thought, it's just brilliant. And another inspiration I find is that I go back to programs quite often, and you see crops in an area that's been cleared at the time you were there before. In an old minefield, there's fertile ground, or there's a school alongside a bit that used to be a minefield, and you just think that's real development happening. And like Gail, I've visited Mozambique, and there were hundreds of thousands of mines literally in Mozambique, and now it's been declared mine-free, and I like to think I played a little part in that, a tiny part, but a little part in that, and that's what makes it all seem worthwhile. I think I've told you this before, but some years ago, development workers were described as mercenaries, missionaries, and misfits, and as you kindly pointed out, we're volunteers, and I'm not a missionary, so I'll leave you to decide.
Thanks, Jonathan. And you talked a little bit there about the very direct impact of HALO's work and seeing that tangible impact. But Gordon also touched on the other medical impacts that we have, and an amazing figure of over 2,000 people treated outside working hours in Zimbabwe in communities with few other medical facilities. Could you perhaps talk a little bit about that wider impact from this medical training that we provide to thousands of people globally?
Yeah, I think when I went to Afghanistan very early in my time with HALO, and I watched the sort of medics in the back of the minefield. It's a slightly different arrangement there, but actually people would come along from local villages, kids pushed on their bikes by their dads, that sort of thing, and they would be seen and they would be treated, sorted out, or sent to hospital. And that's been happening ever since I've been with HALO. The local people have had the benefit of expertise that wouldn't be there otherwise. And one of the things we do is treat the paramedics and the senior medics to deal with minor illness, which is something they wouldn't be able to do but for their training with HALO. And I think that's a really important part of what we do.
And I think, Jonathan, if you could perhaps add a little bit just on the hygiene training that we provide, because of course the medics are also responsible for the hygiene in camps, and that's something that cascades down into their own lives at home.
Well, that of course has become really, really important with the work that we're doing with COVID, and we are constantly reminding them that it's an important part of what they do, and keeping the camps, the remote demining camps, clean and tidy, and hand washing is and all the things we do around that is really important, and I think it will be useful carried forward into the future.
Thank you, Jonathan. One thing that we've touched on a few times through the webinar so far is how interesting this is, and I know that all of our medical board members strike up really strong relationships with the medics on the programs that they visit, despite language barriers, and often you visit programs multiple times, and there's a real warmth and affection between you and those medics, despite the fact that they have very different medical expectations and very different medical backgrounds. Gail, could you just tell us a little bit about that, please? I think we've got some nice pictures taken on various medical visits as well we can show.
Yeah, I think the bottom line is, I think what Gordon said and what Jonathan have said, as well as we all have the same goals. We all want to improve the medical care, just not only for mine-related accidents, but just managing the day-to-day sort of illnesses and things as well. You know, we only have a 1 week or a 2 week visit to the country, and despite the language barrier, it's always amazing how because I think we all contribute our ideas. They have got fantastic, they're a great group of people, whichever country you go to, and they just want to learn from us. And from my perspective, just going to the countries, I like to talk about their food and try their local food. And, you know, they're very keen basically to share that part as well, which is fabulous. I think that's that relationship. And then you visit the country the following year and they get all really excited to see you again, talk about your family. So there's something about it, just absolutely brilliant. Yeah.
I think if we could see that picture once, that slide once again, there are two pictures of Gail in Mozambique and Colombia, one of Jonathan in Jordan, but also I'd just like to point out in the picture in the bottom right is Jane Davis, who is a retired nurse now. And I think Jonathan's been visiting HALO programs for a long time. At 18 years, Jane started working with us 27 years ago now. So yeah, that's an amazing commitment to HALO. So I'm going to move to a couple of questions. And the first one is from Pippa, who's asking, how long does it take and how much does it cost to train a first responder? I'm not sure we've put a cost on it because we train batches of medics alongside deminer training, but Jonathan, perhaps you can talk about the length of the training.
I'm ashamed to say I have absolutely no idea what it costs, but the training is done usually by a senior medic in the country. So it's all the training is done by local staff, and it's usually a 2-week course followed by significant follow-up training in the field. But they will have teaching and training about basic anatomy and physiology, the effects of an injury, illness as well, and then they'll have the practical training about how to put on quite complex dressings and give significant drugs, and they're giving drugs at the scene of the accident, very shortly after the accident, pain relief, antibiotics, and drugs to help clotting. So they're undertaking quite complex medical procedures against a background of usually no medical or nursing training.
Thank you, Jonathan. I've got a question here from David Mackin. I'm going to put this one to you as well, Jonathan, because I know you've been dealing with this directly. And you've touched on it already a little bit. How has COVID-19 affected HALO's medical provision, and have we been able to help in other ways?
Yes, a lot of programs were shut down initially and were unable to carry on normal demining activity, but we have been looking at other ways we can help, and there have been, Zimbabwe is a good example. They've been delivering supplies around the country, which probably would not have happened but for HALO. And HALO's logistics experience and the medical work in combination we've been able to do significant amounts of work in many of the programs to assist with the COVID response.
Thank you. There's a question here from Andrew Rice, who says, you're describing the excellent work of HALO medics in the acute situation. Can you please say a little about longer-term commitment to rehabilitation and chronic consequences, especially in terms of amputations and peripheral nerve injuries? Now, I think I should point out here that HALO is not primarily a survivor assistance organization, although we do work in that field in places where there is a significant gap and where we feel we can make a difference. So I think it may be better if we talk a little bit about HALO staff who've had accidents and where there have been amputations, because obviously we have a commitment to rehabilitation in those cases and in all of those cases. Gail, would you like to just talk a little bit about that?
In terms of staff?
Commitment to rehabilitation and chronic consequences, especially in terms of amputations and peripheral nerve injuries.
Yeah, I don't think HALO basically will be able to it's quite a long-term commitment to that, which I think for if it's a HALO expat or a staff member, basically that's probably something that probably Andrew, basically you probably be able to guide me more on that part.
Perhaps actually, because I know Jonathan has been dealing with a particular instance in where this has occurred, so perhaps Jonathan, you're the better person to cover that.
Well, in Angola, I visited Angola 2 years running in October last year and the year before, and there was a deminer there who'd been injured by bounding fragmentation, which basically had multiple shrapnel injuries to all his limbs, and he lost one arm and had a damaged leg. And he lived in the HALO compound in Wambo, which you may have seen a recent visit there by Prince William, Prince Harry, and he went there. And next door there is actually a rehabilitation centre, and HALO supported that with supported the centre with sort of practical things, mending machines for them. But actually they kept the injured deminer in the compound. He was able to go to the rehabilitation centre from there. He wasn't from that part of Angola. He then, I saw him again the following year, and he was significantly improved. And he was actually then, having been barely able to read and write, he was then employed as a radio operator in one of the more remote locations. So given a real job, undertaking real tasks, doing something really useful, but not that which he was employed for. And so he is now fully employed and working well, and delighted.
So I think in summary, we maintain our long-term commitment to staff who are injured, and we work to ensure they get the best rehabilitation that they can in their home countries. I'm going to take one more question, and it is regarding medical governance, and I will answer a little bit of this. It said, what is the medical governance and medical protocol HALO uses in various countries? So I think it's worth saying that our overall governance is provided by the medical board, which sets our medical policy, sets the training practices, and then directly oversees that with visits to ensure that the procedures are being followed. However, we do also work within international mine action standards, and there are medical standards for medical provision. There are standards for medical provision which we adhere to, and then furthermore there are of course individual local standards, and we're also governed by national authorities in most of the countries in which we work, and their authority does include medical protocols. But perhaps Gail, you'd like to talk more specifically perhaps about some of the international standards that we also employ, for example, the use of tranexamic acid and evidence-based treatments that we provide.
So as I think Jonathan mentioned earlier, we have yearly medical meetings. So the medical board adjourns. We've also divided the medical board into a policy. There's also a trainings committee as well as an audit committee. And with that, we tend to discuss any new medical treatments. So with things like the CRASH 2 trials and the use of tranexamic acid, there's now the CRASH 3 trials as well, which we'll probably have to talk about in the next medical meeting. We talk about equipment, new equipment that is being used, obviously weighing benefits and the cost of it all as well, that we have to think about in terms of providing all the equipment to all the various countries. So there's a lot to cover basically during that one-day meeting every year. And also perhaps every country is different. So in terms of drugs, perhaps one country uses morphine while another country doesn't because of whatever reasons that country does not allow it. So we have to, and also we've got a syllabus that we also want to maintain and keep up to date for everybody to use. So I think we've worked very well as a medical board. We've got a right mix of medical staff, from whether it's doctors, nursing staff, paramedics, that will all have their different expertise that they come together and contribute to that, which is brilliant.
Thank you. We're going to run slightly over, and we have several questions that aren't answered, but we will get back to you by email with responses to those questions. I'd like to finish by thanking Gail and Jonathan for joining us this evening, but more importantly by thanking them and everyone on our medical board, the doctors, nurses and paramedics who comprise that board, and those who've comprised it in the past, for the incredible work that they do. We genuinely couldn't go out and clear landmines in the way that we do without their support. So thank you to each and every one of you. And thank you to all of our supporters. We couldn't send doctors like Jonathan and Gail to the countries we do without our donors. Our next webinar is now scheduled for the 8th of September, and that is with Dr. Fareed Homayun, our program manager in Afghanistan. I hope you'll all join us for that. Fareed has been working for HALO since 1988. He has an incredible story to tell about HALO Afghanistan, about Afghanistan's history itself and the impact we've had there, not just clearing landmines and destroying explosives, but also as a major employer, where it's a country in which we employ more than 3,500 staff. So thank you very much for joining us this evening. I hope you enjoyed the session, and I hope you'll join us on the 8th of September. Thank you and good evening.
Thanks.